Medical licensing can be a hassle, but it doesn't have to be. Blue Shift Medical Licensing takes care of all the details, from the paperwork to renewal tracking. Focus on what you love while they handle the heavy lifting. Plus, mention this podcast, Mindful Medics, for a 5% discount. With Blue Shift, licensing is a breeze. Find them at blueshiftlicensing.com. Hello and welcome to the Mindful Medics podcast, where we dive into the lives of medical professionals, exploring the triumphs and trials from their careers, and uncover how mindfulness practice can empower them to thrive both professionally and personally. Join us as we discover the keys to a balanced, fulfilled, and healthy life in the demanding world of medicine. Today, I'm delighted to introduce my guest. Dr. Diane W. Shannon is an internal medicine physician, author, and certified coach. After experiencing burnout early in her career as a primary care physician, she transitioned to full-time freelance writing, focusing on clinician burnout, system inefficiencies, and patient safety. She co-authored the 2016 book, Preventing Physician Burnout, Curing the Chaos and Returning Joy to the Practice of Medicine. Her podcast, Vital Signs, Thriving as a Woman in Medicine, was launched in January 2024, and it addresses the unique challenges faced by women in medicine and explores potential solutions. Diane now runs a coaching company dedicated to helping women create fulfilling and sustainable careers. So welcome, Dr. Diane W. Shannon.
Thank you, Leonaura. I'm thrilled to be here today.
Excellent, excellent. So let's begin. Please tell us a little bit about your early life and what inspired you to pursue a career in medicine.
Well, that's easy. My mother, who's passed away, was a midwife, and she had an amazing career. She started 2 independent birth centers, in one in Delaware, one in Pennsylvania. And I saw how much she loved her work. And I was actually able to shadow her at times and saw this incredible connection between my mother and these families who were going through natural childbirth. And that I just thought, what career could be better than having the privilege of having that sort of connection, and the sort of connection that really allows for trust, that these families, these women trusted my mother to lead them through this process of childbirth. And I was just so inspired that I knew that sort of connection was something that I wanted.
I love that so much. What a wonderful way to be inspired into medicine. It's funny, I was inspired into medicine through watching television shows, but it doesn't quite have the same resonance. My mother used to say to me, what better job could you have than saving people's lives? And who can argue with that? And I loved what you said about what better job can you have than helping people and being deeply connected with people. That is wonderful. So please share with us a little bit about your timeline in your career and what challenges did you face that then kind of led to you making the changes that we've heard about?
Right. Well, when I started in medical school, I found the academic part to actually be pretty straightforward. There was a lot of memorization, a lot of time spent in the library, but I didn't find that difficult. 3rd and 4th year in medical school, when I started into the clinical rotations, I felt like, wait a second, I don't see this connection between the care provider and the physician. And the patient. There were too many instances where that was interrupted or at least not prioritized. And so I thought, well, this doesn't seem right to me, but maybe I'm just not seeing enough. So kind of continuing in those rotations, and I gravitated towards primary care because there was this emphasis. And in the medical school that I went to, the family medicine department in an urban setting was very strong. And so I saw there is how to create these relationships, these connections with not only the patient, but their family. It really was kind of focused on those relationships. And so then I decided on a primary care focused internal medicine training program in Boston. And I would say that this is when my burnout started, was really in training. I trained before there were any limits on duty hours, and we would regularly work 30-hour, shifts when we were on call. And that was not, there was no sleep involved that first year as an intern. It was 30 hours on your feet the entire time, rushing from one thing to the next. And I kind of felt that by the middle of that year, that middle of internship, I was called into the office of the department chair, who said, "I hear you are having some problems." And I burst into tears. And what he said to me was, the middle of internship is not a good time to make a big decision. And he was right. I pushed through, I continued, I finished that year, and I kept kind of just saying, I'm just going to finish. I'm just going to do the next thing, and kept kind of moving on that way. I then took my internal medicine boards, and I practiced for 3 years. What happened was when I reached that 3-year point, I thought, I don't know how not to burn out again. I haven't figured that out. And back then, there wasn't the awareness of burnout in clinical medicine. There wasn't any sense of well-being. We didn't talk about this. I didn't have a mentor. I didn't have a coach. And I really did not know what to do. But I saw that my choice, it felt like, was one of two things. I continue on and I burn out again, or I leave clinical practice. So those were the challenges I faced. Was really, burnout was a huge piece of that. And just kind of a big part of that, I think, is the culture in medicine, the messages that we get about self-sacrifice. You don't need to be human. You can just keep pushing through no matter what. And that patient always comes first, or that next patient, or just finishing those tasks, that always comes before caring for yourself. And that was a message, I admit, I jumped into. And so that's the part that I can see now.
Yeah, absolutely. And I was having flashbacks while you were talking to my own hospital medicine career. And I was also thinking, it's truly remarkable that everybody doesn't burn out. Expecting people to work 30-hour shifts with no sleep, often very little food, certainly no nurturing of the body, mind, and spirit during those 30-hour shifts. It's truly remarkable that everybody doesn't burn out to some extent. And I think, now that I'm kind of saying that out loud, I think it's inevitable that people will cause some sort of damage from that, and whether they ever talk about it or not, or acknowledge it or not, it's very likely there in almost every person who goes through medical training and doing their internships.
Right. And I think you bring up an important point, because I mentioned the physical aspects, right? But there's also this emotional aspect. And when I think back on all of the codes that I went to, and you become kind of very mechanical almost at these events, because you're focused on the protocol and what do you do next, and who do you need, what lab results do you need back, and everything is a fast pace. But then when it's called, you sit with this person has just died. Someone's family member, someone's loved one has just died, but you don't have time to process this because you've just been paged 5 times and you need to go do the next thing. So that emotional part of just having a space to process what you do every day as a clinician, I think is really important. And that was also something that was missing.
Yes, absolutely. Yeah, you're so right. And I'm just wondering whether, looking back on your early days, was there anything that you wish that you had been coached on? Is there anything that you wish you'd known back then?
Well, I wish I'd known we are human also, like clinicians are also human, doctors are also human, and get to be human, get to have human needs, like time to process, like sleep, like eating at regular intervals. And I wish I'd known how to set boundaries, both with myself and with others, so that I could have, maintained some of that self-care as I was going through the training or when I was in practice. But I really didn't know how to do that. And I've learned since that setting boundaries is a practice. It's a skill you can learn. It's not that you're born with it or that's it. It's something you can learn. And in the beginning, it's not comfortable, right? Yeah. Especially if you haven't been setting limits. But it is something that you can learn, and it makes a huge difference in terms of the bandwidth you have to approach your day and bring your best to whatever you're doing.
Absolutely. I loved what you said about setting boundaries. And I think, in the medical profession, often the more senior doctors are also not setting boundaries, which then sends a message that the more junior doctors shouldn't set boundaries as well. And I think, this is a message for senior people out there. I think it is important to show those who are junior to you that you are human, that you have needs, and that you need boundaries, and to talk about that, and not just, I don't know if you experienced this, Diane, but there was an attitude of, well, we had to put up with this torture, and so you should too. And it's part of the, it's part of the training, and there is no need for that. And I think, the good thing is we now know that chronic stress, you can be successful while being chronically stressed, but there's a risk you're going to burn out. But you can become even more successful if you're not chronically stressed. It's like that managing the stress can help you take your career and your success to an even higher level. And I think most people don't realize that.
Absolutely. And 2 things I wanted to mention in terms of, as we're talking to like the senior leaders and modeling, one is about taking vacation and actually taking vacation and time away. And the other is a simple thing, which is about things like messaging and emailing off hours.
Yeah.
So rather than, if you choose to reply to emails at 10 p.m. or midnight or whatever it is, that's your choice. But ideally, you schedule those to arrive during work hours so that you are sending the message that you're not expecting those that you supervise to respond at midnight, right? Yeah. So those are just 2 ways that senior leaders could model that there is an importance to having some balance and to care for yourself so that you have a long, sustainable, effective career.
Yes, absolutely. So I'm curious, at what stage did you decide to go into medical writing and then into coaching?
Yes. Well, it took me a number of years to decide to leave clinical practice. It wasn't an overnight knee-jerk reaction. When I decided I was going to do that, I did go back. I worked part-time and got a master's in public health, which was such a joy. I loved thinking about big system issues and how they interact health, and it was a real pleasure. So then I wanted to get a job in public health, but I did not find any when I finished my program. And those that existed were kind of very entry level and we were not paying anything like what I needed to be paid in order to pay back some of my loans. And I was very lucky, did not have super high loans, but I had some.
Yeah.
And so this is complete serendipity. I was looking in the back of New England Journal of Medicine at the want ads, and there was one for medical director of a communications company in Boston. And I applied, got the job. And what we were doing there was really creating training for pharmaceutical and device reps. And that was not my long-term goal. That was not what I saw myself doing, but it was a great stepping stone job. And I was there for 3 years. I learned how to write on the job. I learned how to edit. I learned about adult learning design. And I also met a lot of editors. And so after 3 years, I decided, what part of what happened, I was hired to help with new business development and to oversee the accuracy of these training documents. What happened was, again, serendipity. There were some writers who couldn't finish projects for one reason or another. And the president said, Diane, you know this content. Why don't you finish this project? And I just fell into writing and realized I had a knack for it and I loved it. So then after 3 years there, I decided to go freelance. And so I was lucky that I had met all of these editors and I immediately had work. And so I was a freelance healthcare writer for 20 years.
Wow.
And I never marketed. It just went, word of mouth. And I loved what I did. I wrote a lot of what I did was these expert reports that were for foundations that were looking to improve the healthcare system. So I learned a lot about these big system factors that like value-based care or how we reimburse care or patient safety issues, what underlies some of the statistics on why we have so much medical error in the country. And so that led me into the writing. Eventually, I stumbled across the definition of professional burnout. This was about a decade after I left. I had no idea that there was such a thing. I realized that's what happened to me. There's a word for this. So I started just reading as much as I could about it. And that led to writing about it, speaking, being on a national task force, and eventually writing a book with another physician about how to prevent physician burnout, looking at this big system drivers. So what is it about the healthcare system, the external factors, practice level factors, culture that drives physician burnout, and how do we prevent that? And then that eventually led me to coaching.
Wonderful. And I think I have the book here. I'm just going to reach over. Sorry, I should have had it out. Here's the book. Yes. Your co-author, Dr. Paul Deschamps, sent it to me. So I promoted it on the podcast with him, and I'm going to promote it again. It's a really wonderful book. So if you are a physician or a medical professional, check it out. And we'll have the title in the show notes. Blue Shift Medical Licensing offers a concierge service to assist healthcare physicians and other providers with obtaining state licensing. Led by industry experts, their experience and methods allow them to do the majority of the licensing work for you. They have licensed all types of providers across all states and have familiarity with all of the licensing compacts. Let Blue Shift Medical Licensing help you get back to seeing patients and your family instead of worrying about administrative burdens. Plus, mention this podcast, Mindful Medics, for a 5% discount. Set it and forget it with blueshiftlicensing.com. Fantastic. Tell me, how was the book received?
Well, first I should tell you about writing this book.
Yes.
It was such a pleasure. Paul is a wonderful person. He's a family physician who's had leadership experience. And the two of us were introduced by someone who we'd both worked with, who said, hey, here's another physician who wants to write a book on physician burnout. We met, we started talking, and we realized we were on the same page. We spent 15 months writing the book, interviewing experts, physicians who'd experienced this, researchers, and I learned so much about burnout. It was a real pleasure, and we had such a great working relationship. It was just really a great experience. The book has been really well received, and here we are. What is it? It's many years later, almost 10 years later. Yeah. It's 8 years after we published.
Yeah.
And we are still finding that people are enjoying it, buying the book. And, when I go to talk, sometimes I'll mention the book and say, oh, I have that book. I've read that book, which is such a nice feeling. And I would say we actually went back and we updated it in 2020. And then we looked at updating it more recently. But what we found is that the premise still holds, that they're really, yes, in 2020, we talked a bit about the effects of the pandemic, but so much of what drives physician burnout was present before and exacerbated by the pandemic. And so that the really being able to think about what are the factors that drive burnout. Now, as a coach, I can also appreciate that the individual plays a role. And this has been so interesting, is to see where does the role of the big system drivers or the practice level inefficiencies, where do they interact with the individual and the agency the individual has to make changes on their own behalf? Yeah. And that has been a really interesting kind of interface to look at and work with.
Absolutely. And I find the same in the coaching that I do. There are often big system problems as well, but not everybody's burning out. So that gives us a clue that, you don't have to burn out. And what is it about that individual that is increasing their risk of burnout? And it's usually, like you mentioned earlier, not having boundaries, tolerating, things not working, and also neglecting themselves. I don't know if you'd agree. Those are kind of three of the big things that often lead to an individual, and not having the tools or a practice to draw upon. I look back at my years in medicine, and I've been out of medicine 15 years now. I just did not have any tools. I didn't know that stress and burnout was kind of optional, and that I could do anything about it.
Yeah, I would agree with what you mentioned. And a big piece of it, I think, is that those of us drawn to medicine, and maybe especially with the gender roles in our society, women, exacerbating with that, we feel this need to put others first and to please others. And often we don't know that we have a choice. We don't know that we can put ourselves first at times, that it doesn't need to be this so lopsided. And that if we want a sustainable long-term career, we actually need to do that. It is a necessity.
Yes.
And I think that maybe in past decades, it might have been less of a necessity, meaning now it feels like there's less slack in the system, that physicians are being asked to do more with less, to see more patients, so that there isn't some of that, like I said, slack in the system. And so I think that makes it that much more important to really have self-care and your mindset and your practices in place if you want to have a long-term happy career.
Absolutely. Absolutely. I'm curious, do you have you incorporated any mindfulness practice or meditation into your own life?
I have. I've meditated for a long time, but I would say I never thought of myself as a meditator because I don't meditate for an hour. I don't, go on silent retreats, but every day I meditate for 10, 15 minutes. And then I do a quick writing exercise that helps me to kind of surface some of what I'm thinking or feeling. And again, I think maybe because of my personality being, kind of type A, I also shied away from mindfulness practices for the longest time. And it wasn't until I found a process that was very short but regular mindfulness practice that I could really engage in it, and that broke it down to focusing on physical sensations, that really trying to clear my mind and focus on something, tactile or sound or the feeling of my body in the chair, that was something I could get behind. But before that, I just felt it was too big. I didn't understand it. It felt like too much to take on. But these little practices, little bits of meditation, little bits of mindfulness, I find that that's what works for me. And now when I don't do these, I really feel the impact.
Yes, absolutely. Isn't that fascinating? I don't know if you've come across a book by Mishi Jha called Peak Mind, and she's done research into how mindfulness practice can help with performance and with attention. And she did not want mindfulness. She tells the story of how she came from an Indian background where mindfulness was only the men did mindfulness. So as a girl growing up, she was like, mindfulness is just for the men. And when she began her research, she did not want mindfulness practice to be the answer to her question of what can consistently improve well-being and attention and and performance. And it turned out that mindfulness practice was the thing. And what she says in her book that I love, that makes it much more manageable, is that the number she came up with is 12 minutes a day or more, but it doesn't all have to be in one sitting. It can be, it can be 5 minutes in the morning and then 2 minutes spread throughout the rest of the day. And I think, for busy people, it's funny. I was coaching one physician who ran a very busy obstetrics practice, and her clinic was just crazy all day long, and there were emergencies running out. And I'm like, we've got to find some time in your day for you to do some mindfulness practice, or just even to just sit for a minute. And the only time was when she went to the bathroom. And it sounds a bit disgusting, but we came up with this idea of incorporating mindfulness practice when she went to the bathroom, because nobody was ever going to question, you took 4 minutes in the bathroom as opposed to your usual 2. But it was like the only time that she had where she wasn't going to be bothered by other people. And it made the world of difference to her. So sometimes we have to get super creative.
Exactly. Yes. And I've seen that too with the physicians I've worked with, where sometimes if they're a surgeon or if they just have a really busy day, if that's what their day is like, finding ways to work with that. And sometimes what's worked well with some of my physicians is to drive to work and pause in the car before walking in and just take 2 minutes before walking in. Yes. And then it's like set their mind as they begin their day. But sometimes you do, like you said, you have to get creative.
Absolutely. Yeah, I just had an idea while you were talking of, thinking about the surgical team. Wouldn't it be wonderful if surgical teams could do 2 minutes of mindfulness together before they started an operation? I just think that would be a wonderful thing to do that would actually improve performance of everybody in the room. And I often say to people about mindfulness practice, you have to see it as an investment, and that that 2 minutes, 5 minutes, whatever you can fit in, you are going to get that time back multiple times over the day, because you're going to be more relaxed, you're going to be more efficient, you're going to be less stressed. And so we'll have to have a campaign to get surgeons doing and their team doing mindfulness practice. Thank you. We digress. So Diane, tell me, you also have a podcast which came out earlier on this year. What inspired you to start that?
Well, I'd actually done a guest spot on podcast for 7 sessions 7 episodes for the Women in Medicine Summit, which happens every September in Chicago. Wonderful conference. If anyone hasn't been, I'm going again this year. I think this is my 3rd or 4th year going. And I loved it. And it got me over that feeling of, oh, this is a lot to take on to do a podcast. Like I realized I had been making it much bigger than it needed to be. And so when I started, and the other thing I realized is that I loved it. And it reminded me of what I loved so much about writing. My favorite thing about writing was interviewing folks. And a lot of the writing that I did was interviewing those who had either themselves or in part of a team created something that was an improvement. And they had wonderful data to share about something they had changed that improved the experience for clinicians or for patients. So I got to tell these positive stories, and the interviewing was a big part of that. So with the podcast, that's what I get to do. And I love the fact that I get to choose who I talk to. And so the podcast is focused on the challenges women in medicine face. The guests that I have on so far have been either women who have found a way to overcome a challenge, something that they've done. They've changed their schedule. They've learned how to chart differently so they have more time. Or I'm also having on experts who can help us understand what's below the numbers that say that women physicians have higher rates of burnout than their male colleagues. And that has been really fascinating. So things like, yes, women spend more time in the electronic health record, right? But when you look underneath that, part of that's because they get more messages from patients and from staff. So this is the kind of data that I think is so important to share because it helps us, it points us towards solutions. So the solution is not to make women physicians more efficient at charting. It's to distribute those messages, or to give more support or more admin time. Or to compensate for answering those messages. Because without that extra compensation, they're actually being penalized for spending that time communicating with patients. So it's fascinating, and it's really, for me, it's kind of like being in my master's program again, where I get to delve into something and understand what's underneath and what's causing these numbers that we see.
I love that. Brilliant. Podcasting is so much fun. Wonderful. So Diane, my second last question for you that I ask all of my guests is, based on your career in medicine and also what you've done since then, with all of the wonderful ways that you've recreated your career, what are your top 3 pieces of advice for anybody on how to stay healthy and live their best life?
Well, this is some of a repeat of what we've talked about so far. I think number 1, remember you're human and that you have permission to have needs. Number 2 is to learn how to set boundaries and have a script in your back pocket about if someone comes to you in that moment and they're saying, can you do this? Can you add this on? Can you, do this extra thing or join this committee? To have a script ready so that you can give yourself some time to then decide if you really want to do it. So being able to set boundaries, taking some time to learn how to do that. And I think the third thing is to learn how to effectively advocate for yourself. So do you know how to communicate to the decision makers if you want to request a change, let's say in your practice environment? And learning how to communicate that most effectively. We can't control whether they say yes or no, but we can become better at effectively communicating and thinking about what's in it for them to say yes to my request and framing it that way. So those are probably the 3 things that I would recommend.
Wonderful. Great advice. And it's funny, I coach parents of children with special needs, kind of one of my side hustles. And I was talking to a mother yesterday about that being human piece, and we all have to remember it, no matter what challenges we're going through. We are just a human being dealing with a difficult situation. And it's funny, I often get at the end of the call, I'll say to them, and we should all do this now. I want everybody who's listening, including you, Diane, to do this now. I want you to just take your right hand and just place it over your left shoulder and just give yourself a little pat on the back.
I love it.
Well done for being a human and doing your best under difficult circumstances. And it's funny, everybody always laughs, and it's like, we need to stop every now and again and just kind of acknowledge how hard life can be sometimes, and that we are just doing our best. So thank you for doing that with me. So my final question for you, Diane, is we've talked a little bit about what you've got going on, but what particularly would you like our audience to know about and go and do some research on you afterwards?
Great. First is my podcast. I'd love it for people to listen, subscribe, rate it. Let me know what topics you'd like to hear. I always am looking for, experts or topics that people would like to hear about. The other is I'm just starting a new coaching program. It's a 4-month one-on-one coaching program with me, and it's really meant for women clinicians and to help them with some of the most important key challenges that they face, specifically time and energy management, confidence and presence, and then the questions about job fit. If a job is not working, is it something that you can tweak? Or is it something where you need to make a change? And so I'm really excited about launching this program and wanted people to know about it.
Wonderful. Thank you for sharing. That sounds amazing. I wish I'd had you when I was early on in my career. Fantastic. So Dr. Diane W. Shannon, thank you so much for being my guest today and sharing all of your wisdom with us. And to our viewers and listeners, thank you for tuning in. And I wish you a happy, healthy, abundant rest of your day. Bye for now.